I don't know what to say.
Okay.
I've come here for 3 weeks now, and why don't you just tell me what the most important thing to discuss is?
Well, because I'm really not sure. I mean, like you said, this is just our third session, and I'm still getting to know you.
Yeah, well, you know, I thought you were the doctor. I guess I thought you would know where to start.
Well, yeah, I'm the doctor, but it's kind of different in psychotherapy. It's more like a 50-50 collaboration, and I'm dependent on you to kind of tell me what's important and what we should focus on.
Well, I don't know what to say.
Well, I mean, like I said the first time we met, basically the idea here is you say whatever comes to mind, whatever concerns you.
Well, nothing comes to mind. That's the problem. There's nothing on my mind.
Well, we can just sit together silently for a while. I'm sure something will come to mind eventually.
I don't know who that is. Well, this really isn't productive. Let's talk about you. What have you been up to?
Well, thanks for asking, but you know, it sure wouldn't be a very good use of your money or time if I just blathered on about myself on your dime.
Well, what should I do?
You know, I think in a way the problem is in the question. What I mean is this. You asked, what do you do? Psychotherapy is not about doing. It's not about action. It's more like, it's about reflecting, thinking, and trying to figure things out.
Well, that's really zen, but there's nothing on my mind.
Okay. You know, the other important point, I think, is you do not have to talk here. You can, you know, just sit here. This is your time. You can do whatever you like with it.
Can't you just jumpstart me?
Well, you know, I really can't because I'm not sure where you're coming from, what your problems are, and I do much better if you can kind of tell me what's going on inside and like tell me what specific goals that you want to work on.
Well, yeah, where do I start with that? But goals are not my, it's too linear for me.
Well, you knew something was bothering you or you wouldn't be coming.
And things are still bothering me, so I'm not exactly cured.
You know what I think a big problem is here? I think you have a kind of surgical model of psychotherapy.
What's that mean?
Okay. When you speak of jumpstart or cure, a model comes to my mind of like a passive patient like lying on an operating room table, and then an active doctor who is, I don't know, doing procedures, removing things, curing somebody.
Look, I don't want you to remove anything, but I don't know how to fix me, okay? You're the trained therapist, I'm not.
Yeah, I know, and I will help you. But what I'm trying to say is I really don't know where to begin with helping you, and it would be presumptuous for me to start doing that before I really know what's going on with you.
I'm not happy.
Okay.
And the antidepressants didn't work because I'm not depressed.
Yeah, you told me that.
I guess I just feel like my life is not fulfilling.
Well, then tell me more about that.
Well, see, I don't need to go to therapy to say I'm unhappy. I can tell my wife I'm unhappy. You know, she can't help me either. It's just that I feel lost.
Well, I think that's an important observation, George. It's like, the way I put it is, the way you feel lost here says something about the way you feel lost outside of here.
What do you mean by that?
Well, you know, you said to your wife, you know, I'm unhappy, and you said she can't help me. And you feel like I can't help you either. And what it says to me is that it's hard for you to grasp that maybe looking inside for answers is a more useful way to go about things rather than approaching others with the expectation that they'll tell you what's wrong with you and what you should do about it.